Good morning. In this video we're going to talk about the healthcare system in the United Kingdom. The healthcare system in the UK is supported by the NHS, short for National Healthcare Services. It's considered universal and governmental, funded by general taxes, and it's provided to permanent residents. Now let's discuss the cost distribution among different categories. First, among gender and age, the NHS spends more than 2/5 of its spending on the elders, spends on men more than women by 8%. The spending on women increases during childbearing age. Next, among diseases, the highest spending was on type 2 diabetes, following by ischemic heart disease. Then among the 4 regions of the UK we find that in 2019, the highest spending was on Northern Ireland, while the lowest were on England. Then among the health status, the distribution differs according to the number of diseases, and the highest number is found in the rural areas. The UK also spends a lot of money on the disabilities. Finally, among the hospital services, in 2019 the highest spending was on acute service, which treats short-term but dangerous diseases as asthma attacks, followed by mental services, then community health services, which is considered the first step of consultation, and the lowest was on ambulance services. Now let's discuss some of the positive observations of the NHS. The first one is that services are given based on clinical need, not the ability to pay. That is why out-of-pocket spending is below average. They also develop public health strategies that help reduce the number of patients, like prevention programs as vaccinations during COVID-19. They also exclude young children, elderlies and pregnant women from drugs payments. The second one is that they provide transportation costs for people with low income. The last one is that they work on reducing patients occupying beds without need. Now the negative observations. At first, the aging population. The number of elders increases over time due to the great healthcare they get, which reduces the youth's chance of health services. Next, shortage in beds, where the number of beds is very low compared to the average of other countries. Then shortage in staff, where the number of all professional groups in the UK is lower than average, and the number of GPS is lower than the number of specialists, although the referral system makes all patients see GPS before specialists. At last, the appointment time with GPS is 10 minutes, which is insufficient to know all patients' symptoms, where the accepted average is 15 minutes. Thank you for watching.